covers a very important topic in how to improve your sleep. With the hectic pace that we all hold on a daily basis, it's recommended that we try to sleep 7 to 9 hours. And over time, chronic sleep debt can contribute to fatigue, increased stress levels, reduced attention span, and declined cognitive performance. One way to combat the effects of sleep deprivation is with napping. The potential benefits depend on the quality and length of the nap. 10 to 20 minutes reduces sleepiness, improves cognitive performance, increases alertness, attention, and energy levels, improves mood, and improves motor performance, and reduces stress levels altogether. And 20 to 30 minutes usually enhances creativity, sharpens memory. 30 to 60 minutes sharpens decision-making skills, including memorization and recall, improves memory preservation. 60 to 90 minutes, you can achieve rapid eye movement sleep, which is critical for problem solving, helps make new connections in the brain, enhances creativity, and reduces negative reactivity, promoting happiness. Suggestions for better sleep: minimize or avoid stimulants, including caffeine-containing beverages and foods, certain medications, and although not a stimulant, alcohol can definitely adversely affect your sleep. Complete any aerobic exercise at least 3 hours before bedtime, and meals should also be eaten 3 hours before bedtime or a longer time span than that. Reduce nighttime tension and anxiety. Avoid watching the news before going to bed. Avoid paying bills before bed. Avoid arguments before bedtime. Use positive self-talk phrases regarding your ability to relax and fall asleep, such as "I can fall asleep, I can fall asleep." It sounds crazy, but meditation and use positive talk like "I can sleep, I can sleep." Try writing in your journal any disturbing thoughts that are running through your mind, and schedule any time within the next few days to deal with whatever is troubling you. Try yoga or stress-reducing mindful breathing CDs or DVDs to help you find a relaxing bedtime ritual that works for you. Improving your sleep may require some planning and preparing, so schedule 8.5 to 9 hours of sleep. Go to sleep and wake up at the same time each day as much as possible, and begin preparing for bedtime 30 minutes before. Avoid going to bed after 11 p.m. Avoid late afternoon and evening naps that are longer than 45 minutes, and avoid large meals or spicy foods before bed. Finish eating at least 3 hours before bedtime, like we said earlier, and avoid drinking more than 8 ounces of fluid before bed, otherwise you'll be making those trips to the bathroom in the middle of the night. Take a hot salt soda aromatherapy bath before bedtime. This can help soothe you and help you fall asleep easier. If you're having trouble falling asleep or staying asleep, don't stay in bed for more than 20 to 30 minutes while you're trying to fall asleep. Leave your bedroom, read, or do a relaxation technique if needed. Consider reading a good neutral book under low light. If using a tablet or phone for reading, use nighttime setting and lowest possible brightness. Try writing recurrent thoughts that keep you awake in a journal, or consider counseling. Don't use a table lamp for reading. Instead, use a HUD light or other small reading light. You need to work to improve your sleep environment. Turn down lights in the rooms 15 minutes before going to bed. Consider using amber glasses for at least 30 minutes before bedtime to reduce light exposure. Use dark window shades or eye shades. Decrease irritating noises by using a white noise generator or a HEPA air filter. Turn off or remove any appliances or clocks that make noise. Make sure your sleeping area is the correct temperature range, not too hot, not too cold. Find that Goldilocks zone. And try to have your head at least 8 feet away from electromagnetic fields, including electrical outlets, clock radios, stereos, cell phones, computers, monitors. Consider moving these devices away from your bed and even outside of your room. Avoid sleeping with an electric blanket on. Consider replacing your pillows with hypoallergenic pillows. Use ultra-fine allergy pillow and mattress covers. Consider using a side sleeper pillow for under your neck when sleeping on your side. Consider using a body pillow to hug and put between your knees to align your back and shoulders at night. Roll backwards at a slight angle onto a body pillow if you have hip bursitis or shoulder pain. Sleep on the highest quality bed linens you can afford. And of course, there are supplements that can help with sleep. Melatonin, 1 to 5 milligrams to fall asleep, or 5 to 20 milligrams of time-release melatonin to stay asleep. You can use 5-HTP an hour before bedtime, taurine 1 hour before bedtime, Magnesium would be excellent also, and 200 to 400 milligrams is a typical dose. To decrease nighttime cortisol or stress, consider using ashwagandha and a few other of these listed supplements. Establish an evening herbal tea habit, such as lemon balm or passion flower, to support relaxation and sleep onset. And when it comes to light, consider a half-hour exposure to a blue or 10,000 lux bright light first thing in the morning if you are going to bed too late and want to shift to an earlier bedtime. Try these out and you should see a significant improvement in your sleep and your overall mood. Talk to you soon.